We're going to position for the swimmer's lateral. This projection you would do if you weren't able to see all the way through T1 on your lateral cervical spine. On some patients you may need to do this also for lateral thoracic, because on lateral thoracic spine sometimes we only see T3 through T12. So we want to do this for the upper portion of the thoracic spine or the lower portion of the cervical spine. You can also do this with the patient erect or recumbent. The patient may be on their side, as this patient is, or they can be on their back if they were a trauma patient. We're going to use 10 by 12 image receptor lengthwise, and we're also going to use a 10 by 12 collimation and 10. Next, we want to make sure that the patient's in a true lateral position. We have a shield and we have a marker on either the IR or the table. There are no artifacts, no necklaces, no jewelry, no earrings, no snap buttons in the area of interest. It is a left lateral, so we're going to place a left marker out of the area of interest. Now we want to place our central ray at the level of C7 and T1, which sometimes you can find the spinous process in the back of the patient, the spinous process of C7. I usually find that if I use the top of my shoulders, that's the level of C7, T1, and the chin will be up slightly. Now the downside arm would be up and above the patient's head, and the downside arm is going to be down by the patient's side. You want to depress this shoulder as much as possible. This is why it's called the swimmer's technique. We can do a breathing technique for this position, or we can do a non-breathing technique as well. And if the patient can do a breathing technique, obviously you can. Okay, so I'm going to give the patient breathing instructions. Just breathe normal and don't move. And then they can breathe and relax. Now, if the patient is not able to depress those shoulders enough, you want to use an angle of 3 to 5 degrees caudal. And that kind of separates it brings the humeral head away from the area of interest. So one humeral head is going to be forward, one is going to be backwards, not on top of the cervical spine or top of the thoracic spine. So then I would readjust that to C7, T1, center, and then that would be my other way of doing the swimmer's technique. And that's it for swimmers.